Welcome back to the Virtually Vikings radio show, the half-hour program that will be discussing all things St. John's River State College. Each week, we'll be providing a spotlight on new degrees or programs, events, resources that are offered here through the college. I'm your host, Mickey Johns, and today we're going to be discussing all things HIT program, or Health Information Technology, with Dr. Charlene Libiday, the Program Director for the Health Information Technology Program. Thank you so much for joining me today, Dr. Libiday.
Thank you for having me. It's a pleasure to be here.
I absolutely love that you reached out to do this show. I know enough about the HIT program to kind of direct students to your assistants. So I'm excited to learn more because I think it's kind of a gray area for a lot of students and a great opportunity. Would you mind sharing the background? I know when we were kind of prepping to get started, we started at the same time. How did you come to be in the health information technology realm and here at St. John's even?
Yeah, happy to share. And you're absolutely right. I consider it the best kept secret in healthcare careers. There are so many opportunities within health information technology. So I was 16 years old when my primary care physician was like this prophetic voice in my life. Hello, Dr. Lasso, if you're watching. He told me that I should consider studying computer science, work in healthcare, and help physicians implement electronic health records because that was the wave of the future. That was 1987. So fast forward a couple of years and I started my career in health information management fresh out of high school. I was looking for a part-time job while I was working on my associate's degree. And I had a friend who worked in the cafe at Mayo Clinic. He told me it was a great place to work and suggested I apply. So I did. And they were not hiring in the cafe, but fate would have it, they did have a file clerk position in the medical records department. I had no idea at the time that I'd landed a role that would really lay a solid foundation for a fulfilling career. And simply by being present during a time in history when they were making that conversion from paper to computerized records, I kind of organically became this electronic health records expert and figured I should probably follow Dr. Lasso's advice and get that degree in that. So I did, and I was at Mayo Clinic for 25 years. Half that time spent in health information management roles, doing pretty much anything you can do in the department, filing records, records analysis, medical transcription, coding. I was an electronic medical records coordinator and ultimately a part of the leadership team, and then transitioned to a role in the IT department where I held roles as a programmer analyst, a change manager, an IT educator, and finally a senior IT business relationship manager dedicated to Florida operations, where essentially partnered with the clinical practice on strategic initiatives, implementing AI in the clinical setting, bringing new cancer therapies to North America for the first time. At one point, even scrubbed in for a heart surgery. So it was very exciting work. I was perpetually inspired and enabling the work of some of the most brilliant minds in the world. I feel super fortunate to have had the incredible opportunities and to cross paths with exceptional people in my career over the years. But as far as SJR State, so I'm an educator at heart. It kind of goes to the core of who I am. And it's the thing that fills my cup. You know, it gives me the most joy and purpose. I literally got a doctorate in education for fun, like no career aspirations, just because I loved it. And that's how much I enjoy education. So after my kids were out of high school and I started kind of reassessing what I wanted to do with the rest of my life, there was no question that I wanted to be involved in educating. So my inspiration comes from really empowering the next generation of professionals with the knowledge and the skills to continue advancing healthcare through technology. proper health information management really directly impacts patient care and the quality of it. And it informs it and making those data-driven decisions. The evolution of electronic health records created really exciting opportunities to improve healthcare delivery through better data management. And teaching in this field allows me to continue to drive that forward with the transformation of our healthcare system while making a tangible impact on the lives of students.
And all that from a doctor mentioning the the opportunity out there, and then a part-time job in a cafe opportunity. That is
Exactly. Yeah.
amazing, and it just shows you, I mean, you're meant to be where you are, and you can hear it in your voice that it's the ones that want to be here, and which is many of our I mean, most of our faculty, majority. However, you're supposed to say that to say that it's a passion here at the college for from our faculty to help our students. You can tell how much of a benefit you are to your program for that passion that you have for helping people and the education portion of it. I'm excited. I want to hear more about that. Unfortunately, I have to go back to the actual program, which is a good thing too. I want to learn about the health information technology. Could you break it down in its simplest terms for people who, I know you kind of said it just now, but if you were trying to explain it to someone who had no idea about anything, what does health information technology, as far as our program, when you graduate, what are you doing?
Yeah, it's a running joke in my family that no one really has any idea what I do.
I
And
appreciate
and
it, but what is it?
yeah, so St. John's River State College offers this associate in science degree in health information technology, and the program prepares students to become registered health information technicians, or RHITs. And this is through comprehensive training that combines healthcare knowledge with information management skills. Health information technology professionals play a critical role in maintaining, collecting, and analyzing the data that healthcare providers rely on to deliver quality healthcare. So they're experts in managing patient health information and medical records, operating computer information systems, coding diagnoses and procedures for reimbursement, and maintaining quality control of health records. Health information technicians, there are a variety of roles that they can hold, but to name a few, they can serve as medical coders, clinical data specialists, data quality managers, and information security officers. Students are eligible to sit for the National Certification Credentialing Exam to become a registered health information technician after completing the program during their last semester with the approval of the director for early testing, which I'm always really happy to grant. I think it's better to take the test earlier rather than later whenever all the information is still fresh in the student's mind. The RHIT exam is a national certification. It's offered through the American Health Information Management Association, also known as AHIMA. And for the RHITs in Florida, the average annual salary is currently $45,344 as of March 2025. So not a bad starting salary for one with an associate's degree.
I did it
The
wrong.
typical Yeah, the typical salary range falls between 40,000 and 51,000. Classes for the HIT program are offered completely online. The program length is 2 years, so it is an Associate of the Science degree. There is a 4-year option to go on and pair it. It complements really nicely with Dr. Balkanoff's Bachelor of Applied Science and Organizational Management. There's a specialization in healthcare administration that, again, pairs really well with the Health Information Technology program. It is 70 credit hours over 6 semesters starting each fall.
Those were my next questions. So it is completely online. It starts
It is.
predominantly in the fall. So students, as of right now, could still be applying to get into that. And within 2 years, you're out, as long as you pass the test. making really good money, way below the minimum wage, in a career field helping others that has a lot of growth coming into it, if I understood that
Exactly.
correctly.
Yeah, yeah.
Which is an
The
amazing idea.
Yeah, and the program, it really prepares students for various roles in healthcare settings. There are so many different paths that you can take. Um, RHITs typically work in hospitals, but they're also found in other healthcare settings, including physician practices, nursing homes, home health agencies, mental health facilities, and public health agencies. So they could also work in organizations that use patient data, such as pharmaceutical companies, law firms, insurance companies, and health product vendors, even electronic health record companies. So lots of different opportunities within the space.
Unlimited different places you can go within the corner and an amazing growth opportunity with it. That sounds like an
Yeah,
amazing program. How would you compare our program with other programs in the like as far as the health information technology program goes? What's the benefits or what's the things you can like brag about as far as our program?
I think what makes our program distinctive is its flexibility, offering those general education courses on all three of our SJR state campuses or online. So you have that. If you're one that enjoys being in the classroom, you could certainly take the general ed courses in person. There's also the option to do them online. With the degree-specific health information technology courses, the availability is entirely online. Professional prof- professional practice experiences, easy for me to say, are scheduled in healthcare facilities. So it's essentially the internship that takes place in the final semester. So we have these partnerships with healthcare facilities within the regional area, giving students real world exposure while maintaining convenience. And I also have to say another strength of the program that sets it apart, I would say, would be our instructors. We have just the most amazing instructors in our program, and who have just a wealth of experience in different realms. And I would say they're everything I'm not. You know, what I bring to the table, they just perfectly complement what I bring. And I can't say enough good things about the high caliber and the talent of our instructors in the program.
I always love hearing that. And it's an amazing part that St. John's does. We definitely hire to complement each other to where there's not many gaps in our instruction fields, but when we do have somebody who has a better strength in something, it's amazing how awesome everyone is willing to step in and kind of help each other. I
Yeah.
students, I think once they realize, or once they experience it, they definitely understand how amazing and supportive our programs are. Are there any I so with our other medical programs, they're all limited access. Our rad tech or respiratory care, the radiology technology program, our nursing programs, not our EMT and paramedic as we've learned. But are there any prerequisites before a limited access application, or can students, start working within the Associates of Science degree and they are in the HIT program in that respect? There's not an extra application?
So
That was a
the
really
health
long question to
information,
go
that's a really
loop
good
around.
question.
Sorry.
Yeah, thank you for asking. The Health Information Technology Program is a limited access program. Thank you for bringing that up. To apply for admission to the HIT program, a student must have completed an application to SJR State. So
Okay.
you have to be a student at the college, and then apply to the Health Information Technology Program, which is on the HIT program page. There's a link to it. That application is open from April 1st till June 15th each year. So we take applications in the spring with a fall start date.
Which
In
makes
addition,
complete
as
sense.
far as prerequisites, so there are essentially two. You need to have achieved satisfactory scores on college placement tests for reading and writing, scoring equivalent to placement in English Comp 1. Or you need to have completed English Comp 1. And you need to likewise have achieved those scores for a general ed math or completion of a general ed math core class. So if you have your English and math, or you've scored on the placement tests showing that you can place into them, you're absolutely all set and welcome to apply.
And that's a significant less prerequisite. So someone who's looking in to change a career or coming straight out of high school and wanting to get their career jump started, it's a lot less prerequisites than some of our other medical fields this way.
Right.
And then I always kind of explain the health information technology is if you want to be in medical fields, but you don't want to deal with the actual human part of the medical field. Because some people are interested in the medical field, but
Mhm.
I mean, I'm a self-diagnosed hypochondriac. I could not be one-on-one with patients, even as our nurses and rad tech students do. I could not do it. So that's it's a great opportunity to kind of jumpstart or even look for a career opportunity without having to actually interact so much with
Mhm.
the patients you're helping. You get to do the background work
Yeah,
very quickly.
absolutely.
2 years and out. I can't get beyond that,
Yeah,
even
it
knowing
is
it.
the business side of healthcare, literally. So students learn competencies around health data management, medical coding, healthcare privacy and security, electronic health record systems, and healthcare statistics. And the curriculum follows the competencies that are outlined by the American Health Information Management Association and our accrediting body, CAHIM, which is the Commission on Accreditation for Health Informatics and Information Management Education. So our partnership with these organizations really help to ensure that graduates are prepared to enter the field.
Well, that's actually my next question. I love how you just leaned in on that one. What's kind of I mean, the pass rate is how I'm supposed to say it, but the success rate, how are we doing as far as students coming out and doing those exams? I asked for you to brag earlier. Do we have an amazing pass rate for our students for that exam?
We do. Currently, we have a 100% pass rate. Super proud of
Woohoo!
that.
So the highest on our college for any of our pass rate certifications. I mean, and a lot of our programs are pretty big. That's amazing.
Yeah,
Definitely
the
worth doing.
program, it is specifically designed to prepare students for that RHIT certification exam. So the program's curriculum, again, aligning with the AHIMA competencies to ensure that graduates are well prepared for that certification exam. And we're really proud of that 100% pass rate. I think part of that is due to our HIT Student Association, which hosts monthly RHIT prep sessions. So because
Okay.
it's an online program, it is virtual, it's completely optional. We even open it up to our former graduates if they haven't taken the exam yet and they want to brush up and practice. We do it each once a month on Thursday evenings. It's using Kahoot quizzes. So it's really fun. It's just a competitive environment where students and former graduates can join together and practice the content together.
So we prepare them and we constantly help them pass that test or the exam. What other support? I mean, that's a lot of support in itself. What other support are we providing for the job market side of it? I know we have Michelle Fox helping on our career services side. Is there something specifically within the health information technology program that's helping students?
So the college provides various support services for
Mm-hmm.
career preparation, as you alluded to, and including academic advising and library resources and tutoring. The professional practice experiences also help students build professional connections that can be valuable in entering the job market.
Yes, it's it's so cool how many supports we have. I try to get more students to use them, and it's definitely the word's getting out. It's great to see how busy Michelle often is and the career services side. There's no excuse to not have a plan when you graduate from us. with all the resources we have and with 100% pass rate. We should definitely be filling positions on that health information technology side. Are there specific partnerships that we use within the program? I know you mentioned that we have students all over. Where would folks find us? And would you mind naming a few?
So, sure. So our professional practice experiences, they are required and are scheduled in healthcare facilities within the regional area or
Okay.
remotely nationwide.
Oh,
And these experiences really provide crucial hands-on training in real healthcare environments. The program maintains partnerships with various healthcare facilities within the region, including Mayo Clinic, Flagler Hospital, Ascension, where students complete their professional practice experiences. These partnerships really help ensure that students gain relevant real-world experience in diverse settings. Our partnership with Mayo Clinic in particular, during the pandemic, they were the only healthcare facility that would still take students because they had a virtual version. So,
right.
that was a time when it was hard to get on site, right?
Yes.
And because they had they really expanded their virtual internship at that time. So a lot of students like the Mayo Clinic name on their resume, right?
Not a
And
bad
that
hospital I get to claim.
Right, right. So that virtual internship has sort of become the one that most students prefer. But again, we have lots of relationships with regional healthcare organizations.
In other words, like every other medical program, you can find us all over Northeast Florida, from up through
Yeah.
Duval County up and even Volusia for some of our programs, and out west. So when you see the logo, you know that we're prepared. I love being able to go into the hospitals and our local facilities in different areas and see that our scrubs out there, we know those students are ready to help. Is there any, with all the professional support we have on campus, are there student organizations? I know like the nursing program has a club. Are there or professional development opportunities for our students to do while they're here with us?
Yeah, we have an HIT student association that is
Okay.
very active. They meet 3 times a month.
Oh, wow.
On Thursday evenings, they host a monthly opportunities and HIT session where local professionals come and share their career path to expose students to all the various opportunities they can pursue with their credential and their degree and learn about career paths. They host life sessions where former program graduates come to learn from their experiences. And then, as I alluded to, the RHIT prep sessions where they prepare for a successful credentialing exam. It's a great opportunity to get involved, to start building networks, and to gain leadership experience.
Now, I know within working with in another position, I kind of helped fill out. A lot of the nursing students mentioned that even if you were just interested in nursing, come hang out in their club's position, like kind of see what's going on and make sure it's something you want to do. Would that be something you would suggest for someone learning about the health information yep, easy for me to say. The health information technology, it's why I usually call it HIT. Or would that be a good idea in like learning more about it?
Yes, absolutely. Especially the opportunities in HIT sessions. Those we invite everyone to. We will invite the entire college, the entire student body, as well as our faculty, just to in our advising team, so that they can learn more about the profession and effectively advise students who come to them wanting to learn more information about the different opportunities with degrees. But yes, absolutely.
Perfect. So even like that one-on-one interaction with the students already in the program. So students,
Mhm.
if you're on campus on Thursdays, definitely check in with the student coordinators in the view building and they can help you find a classroom or the area that the group's meeting.
So it
Okay.
is, thank you for
Yeah.
saying that. It
Oh, yes.
is all virtually. So we
Just
do
kidding.
all of
Don't
this.
come on campus to find it.
It's all virtually by teams.
And you did say that, and I was just ready to meet people in person. I'm an in-person person, so when you put me on this webcam, I don't do well. Um, I'm gonna go back to that whole I need you to brag some more because I always loved learning from instructors and directors of programs. What's the job placement rate for the HIT program?
Again, 100%. So we
So
are, we're
100% passing, 100% in that job.
mhm.
I like
All of our
stressing that.
students, all of our graduates are acquiring roles. And one of our recent star students actually went on to she did her internship at Mayo Clinic. Then she acquired a role, an entry level health information systems analyst role at Mayo Clinic. And within a very short period of time, she was promoted to supervisor. So she is now a part of the leadership team that originally hired her, and she's mentoring others. So it's upward mobility with the degree is also we've seen with our students pretty quick if one is applying themselves.
That is, I'm definitely something to brag about, and I love hearing student success stories. With that, I keep pointing out that it's a great idea. Let's kind of do the nitty-gritty part of it. Can you kind of explain the approximate cost of the program? It's something we definitely get to brag about here. But what would that cost be for students looking to jump to a new career or definitely go into the HIT program?
Sure. We are, I think, one of the most affordable
Hmm.
programs. So, I mean, getting right down to the bottom line, the grand total is $10,877.24. So,
For a two-year
um,
degree that you could
for a
start
two-year
making.
degree. Yeah. Well, actually, for AHIMA members, which
Hmm.
AHIMA membership is included with the program, so that actually brings it down to 10,807.24. And to break it down a bit, so first year is 37 credit hours. The tuition and fees are 3,996, so just under $4,000. There are lab and course fees at 114. You do undergo a criminal background check and drug screen during kind of the application process that the student pays for, and that is 171, as well as physicals and shots. If the student pays for that, if they don't already have it, that would be 400. And then textbooks kind of average around 887. So first year around $5,500, and then second year is 33 credit hours, and tuition and fees are right around $3,500. Lab and course fees are 313. Um, Again, that annual drug screen, this time it's 40, and then textbooks are right around $1,000. So second year is ballpark right around $5,000. And then the RHIT certification exam is $299. There is an opportunity for a scholarship with the American Health Information Management Association. They award scholarships to pay for that credentialing fee each year for students. So always encourage students to apply for that scholarship. And I've had several be awarded the scholarship and have their certification fee cost paid for. So it's, again, as degrees go, really affordable, and it's just a great program. It is. It's an amazing opportunity. And back to kind of my original statements, I think the best kept secret in healthcare.
I try to push it out there, but it's a very bit of a mystery. Okay, so we talked about all the money. You brought up the
Mhm.
scholarship opportunity for the certification. It is financial aid active as far as they complete a FAFSA. If the student is grant eligible, they can use their grants. They could use Bright Futures. They could use, the random scholarships from the county that they might earn. This is something that they can use that financial aid for too, correct? It's not gonna, there's other ways of helping fund that very limited cost to begin with.
Exactly.
Okay. So, I mean, even being a very affordable, because that's the better word to use and the one I like using, um, opportunity, there's other ways to even help bring that cost down to start a career that is just within 2 years. That's an amazing option. And I know we talked about applying earlier. If you could just go through the application steps with me one more time before we close out.
Sure. So prospective students can apply through the college's standard application process, and then go to, once you've applied to the college, you would go to our HIT program page. So it's
Okay.
sjrstate.edu/HIT.
Mm-hmm.
And there on our HIT program page, there is a link to apply to the program. And once you're a student with the college, that application will pop up with all of your information already pre-populated, has a few questions there for you to answer to formally apply to the program.
Mm-hmm.
And you simply submit that. It's all done online. And then that is available through June 15th. In July, we'll be having our orientation. So by
Mm-hmm.
end of June, those who are accepted will be notified. And July, we'll have orientation, again, completely online.
Mm-hmm.
And then in August, we'll start classes.
The flexibility of things being online and so quickly done, it's just crazy. And in my opinion, someone who wants to get in the medical field as an opportunity, this is definitely that secret we've got to get out for students. So thank you so much for joining me and sharing your secret hidden program on our campus.
Thank you so much for the opportunity. I appreciate being here with you today.
And thank you, listeners, for tuning in to the episode of Virtually Viking. We hope you've enjoyed our discussion with Dr. Charlene Livaday, who is the director of the program for the Health Information Technology. If you have any questions or have about today's show or any other ones or topics that you want us to cover in future episodes, we'd love to hear from you. Please reach out to us at virtuallyvikings@sjrstate.edu or through any of our SJR State social media accounts. Your feedback and suggestions are always welcome, and it's how we are able to guide future shows. Remember, whether you're looking to start a new career, health information technology is going to be a really good one, advance in your current one, or simply explore new subjects, SJR State has the resources and support you need to succeed. We're here to help you every step of the way. Until next time, go Vikings!